The next transfer we're going to demonstrate is moving somebody from the bed to a stretcher or a lateral transfer. We've already positioned the plastic slip sheet underneath the patient and with a draw sheet. We're now going to position the transfer board that bridges the gap between the two surfaces. We roll the patient using our safe technique and we position the transfer board underneath the draw sheet. This will provide some rigidity to the mattress as well as bridge the gap. We do all this positioning before putting the stretcher in place so that we do not need to bend over it. We're now going to move the stretcher into position. The receiving surface should be an inch or two lower than the starting surface so that we're working downhill and not fighting against gravity. We then position the second slip sheet on top of the transfer board so that it increases the friction reduction that we have rather than having to work over the top of the board. 2 sheets can be used for very large patients. If the patient is able to help and is not that heavy, 1 sheet will suffice. So what we start with now that everything's in position is the caregivers on the sending side will maintain good body mechanics and segmentally send the patient to the middle of the surface. Starting with the shoulders, they begin to push over, moving the shoulders and the hips and then the feet. And then the second caregiver, once she can comfortably reach, will grab the draw sheet and we will then pull the patient onto the receiving surface. Again, when we're pushing, we want to keep the back straight, make small movements to partially send the patient over. Then the receiving side becomes the prime movers, keeping an upright back. They reach forward and then rock using their body weight to pull the patient the rest of the distance over. Once we are on the new surface, the transfer sheets can be slid out from underneath the patient to make sure that they do not cause a sliding risk while we're transporting the patient.